Good day, and welcome to Wally's nursing videos. Today we are going to delve into the pharmacology of neurological medications. Neurological conditions, including headaches, epilepsy, and Parkinson's disease, can have a significant impact on patients' quality of life. It's essential for us as nurses to understand the drugs used to manage these conditions, their mechanisms of action, and nursing considerations. Headache, migraine. Sumatriptan, Imitrex, a selective serotonin receptor agonist used in the treatment of acute migraine attacks. Mechanism of action, MOA, acts as an agonist at serotonin receptors on blood vessels, constricting affected vessels and reducing pain transmission in the trigeminal pathways. Adverse effects. Common adverse effects include chest heaviness, drowsiness, vertigo, and more. Contraindications and cautions. Contraindicated in patients with coronary artery disease, CAD, and use should be avoided during pregnancy. Nursing considerations. Monitor patients for chest heaviness. Ensure good oral hygiene to reduce the risk of gingival hyperplasia. Anti-epileptic drugs. Epilepsy is characterized by 2 or more unprovoked seizures occurring more than 24 hours apart. Managing epilepsy involves controlling seizures and minimizing side effects. Traditional AEDs, anticonvulsants, efficacy is known, but they have extensive side effects and drug interactions. Phenytoin, Dilantin, used to control tonic-clonic and complex partial seizures. Monitors free levels of the drug. MOA, selective inhibition of NA+ channels. Adverse effects. Common adverse effects include sedation, gingival hyperplasia, and more. Contraindications and cautions. Contraindicated in patients with a history of bone marrow suppression, and it interacts with oral contraceptives and warfarin. Nursing considerations. Monitor cardiac status during and after IV administration, ensure good oral hygiene, and administer the drug slowly. Carbamazepine, Tegretol, used for generalized tonic-clonic and complex partial seizures. MOA, selective inhibition of NA+ channels. Adverse effects. Common adverse effects include visual disturbances, ataxia, vertigo, and more. Contraindications and cautions. Contraindicated in patients hypersensitive to this drug or tricyclic antidepressants, TCAs, and those with a history of bone marrow suppression. Nursing considerations. Monitor CBC and assess hepatic metabolism. Valproate, Depakote, used for various seizure types, bipolar disorder, and migraine prophylaxis. MOA. 3 mechanisms include selective inhibition of NA+ channels, suppression of CA2+ influx, and augmentation of GABA influence. Adverse effects. Common adverse effects include hepatotoxicity, NNV, and more. Contraindications and cautions. Contraindicated in patients with a history of bone marrow suppression and those who have taken an MAO inhibitor within 14 days. Nursing considerations. Monitor liver function, and ensure cautious administration due to various black box warnings. Phenobarbital, used for partial and generalized tonic-clonic seizures. MOA potentiates GABA. Adverse effects. Common adverse effects include sedation, learning impairments, and more. Contraindications and cautions. Should be used with caution in pregnant women and monitored for potential physical dependence. Nursing considerations. Administer slowly to avoid CNS depression. Diazepam, Valium, used for tonic-clonic status epilepticus and anxiety. MOA, potentiates the effects of GABA and suppresses the spread of seizure activity. Adverse effects. Common adverse effects include drowsiness, dysarthria, and more. Contraindications and cautions. High potential for drug interactions. Nursing considerations. Administer with care to avoid drug interactions, ensure emergency resuscitation equipment is available, and avoid mixing with other meds in the same IV line. Levetiracetam, Keppra, used for various seizure types, including myoclonic and tonic-clonic seizures. Also, it's used as an unlabeled option for status epilepticus. MO inhibits abnormal neuronal firing. Adverse effects. Common adverse effects include drowsiness, dizziness, and more. Contraindications and cautions. Contraindicated in pregnant and lactating women. Nursing considerations. Monitor liver and renal function tests and be aware that it's only given IV for a short period. Anti-Parkinson drugs. Managing Parkinson's disease is complex, and patients may require various treatments, including monoamine oxidase type B, MAO-B inhibitors, amantadine, dopamine agonists, DAs, and levodopa. Sinemet, levodopa carbidopa, used for idiopathic Parkinson disease, postencephalitic Parkinsonism, and symptomatic Parkinsonism resulting from carbon monoxide or manganese intoxication. MOA. Levodopa relieves Parkinsonian symptoms by converting to dopamine in the brain, while carbidopa inhibits the decarboxylation of peripheral levodopa. Adverse effects includes syncope, orthostatic hypotension, agitation, and more. Nursing considerations: administer at the same time every day. Selegiline, Eldepril, used as an adjunctive treatment with levodopa-carbidopa for managing Parkinson disease. MOA, selective inhibition of MAO-B. Adverse effects includes insomnia, dizziness, and GI symptoms. Nursing considerations: teach patients to recognize and report signs and symptoms of serotonin toxicity. Amantadine, Simitrel, used for Parkinson's disease and can manage dyskinesias. MOA, promotes dopamine release. Adverse effects includes confusion, lightheadedness, and anxiety. Nursing considerations: the positive effects may wear off after a few months of use. Monitor renal and liver function. Other chronic neuromedications: interferon beta-1A and beta-1B, used as first-line therapy to decrease the frequency and severity of multiple sclerosis attacks. OA inhibits the migration of pro-inflammatory leukocytes across the blood-brain barrier. Adverse effects includes flu-like reactions, hepatotoxicity, and more. Nursing considerations: monitor liver function and CBC, teach patients to rotate injection sites. Neostigmin, used for myasthenia gravis. MOA inhibits the breakdown of acetylcholine. Adverse effects include muscarinic receptor stimulation. Nursing considerations: administer with caution, coordinate activities requiring swallowing with peak effects of medications. Understanding the pharmacology of neurological medications is crucial for nursing practice. Each of these drugs has its unique features and considerations. Remember to apply your knowledge with care and compassion when managing patients with neurological conditions. Thank you for joining us today on this deep dive into the fascinating world of neurological medications. Whether you're a nursing student, a seasoned nurse, or someone just curious about the field of pharmacology, I hope you found this information valuable. Understanding how these medications work, their potential side effects, and how to care for patients taking them is a vital part of our role as healthcare providers. By staying informed and attentive, we can make a real difference in the lives of those facing neurological challenges. Remember, patient care is not just about administering medications. It's about providing support, comfort, and hope to those in need. So, as you embark on your nursing journey, keep learning, keep caring, and keep making a positive impact on the lives of your patients. If you enjoyed this video and found it helpful, please give it a thumbs up and subscribe to our channel for more informative content on nursing, healthcare, and more. Feel free to leave any questions or comments below, and we'll do our best to assist you. Thank you again for tuning in today. Wishing you all the best in your nursing career, and as always, take care of yourself and your patients. See you in the next video.